Good afternoon, everyone, and thanks for joining us today for our third healthcare provider update, where we share information related to COVID-19 and other information. So I think a number of people have been clicking on our poll, and just so we get a bit of a sense of who's on today, by way of introduction, my name is Alana Fitzgerald-Hushek, and I'm one of the Associate Medical Officers of Health here with York Region Public Health, and I'm joined by my fellow AMOH colleague, Dr. Richard Gould. Today's topics are based on questions we've been receiving and that are top of mind for many. So we're focusing on school reopening and some updates and resources around influenza and immunizations. And I'd just like to give a big thank you, first of all, to everybody who's joined us today, as well as to our amazing team who helps us with our webinar. So thanks to Sarah, Brooke, and Emily, and our comms partners as well. So just a few housekeeping items to take care of. So this is a live stream and we will be monitoring the chat box where you can submit questions to us. You won't see each other's questions on the screen. Those come across to us and we'll be monitoring, and we'll do our best to get to as many of them as we can at the end of the presentation, or if there's quick ones, possibly we may be able to answer as we go. Anything we're not able to answer at the end of the presentation, if we run out of time or too many questions, or there's a need for links or resources, we'll be sending those out along with the slides and posting them on our website, and we'll be doing that via our Public Health Matters website. And the email on the screen here, you're always welcome to reach out and get in touch with if you've any questions. So there should be a little feature that has a Q&A, probably on the right side of your screen, and that's where you can submit a question and press send. And as I said, we'll be monitoring those on our end, and we'll do our best to respond to those as we, at the end of the slides, at the end of the sections that we have, and then we'll otherwise follow up with everybody afterwards. So just to have a sense of who is on the line today, and thanks to those who have been able to fill out the poll. Okay, so we've got a good number who have joined here, and from different parts of the region, which is great. Okay, for where you practice, and then in terms of who's on the line, so a number of different primary care, specialty physicians, different other health providers and colleagues as well. So that's great. Thanks again for taking the time to join. So the focus for today, I think we'll just slip back over, is again, we'll give a quick overview of some of the recent trends that we're seeing in York Region in terms of COVID-19 before shifting gear over to a few updates and resources on immunizations, particularly influenza, and a bit on grade 7 program as well, and catch up for grade 8s and others around immunizing during COVID times. And then a big focus, of course, is on our school reopening. And I'll hand over to Dr. Gould, who'll speak to this afterwards. So first, here's a quick snapshot on what's been going on recently in York Region. So this graph here shows, as you can see, over time where we've been in the pandemic from the very beginning, as well as seeing where we are seeing once again in recent times a trend towards more cases, as well as complexity has been increasing of our cases, and the number of contacts per case has been increasing. So prior to March break and at the start, we did mostly see travel related cases. Those are the ones in pink, in the pink line. And local transmission, close contact, that's the blue line, which has remained a pretty high proportion. So these might be household contacts as well as sometimes in the community. And then we did have a sharp rise institutional related, so things like long-term care, congregate settings, that's the green line, that was at the peak of the pandemic as well. And we have also then the yellow line, or the gold colored line, is our workplace outbreak related cases, where we have had consistently some going on and a bit of a peak, more so through this summer around mid-June. Since phase 2 and stage 3 reopening, across the health units here in Ontario. Around mid-August, we have seen a bit of a reemergence of some of the locally transmitted cases, and more recently with our spike in cases, a number of these have been linked to community events such as private parties or gatherings or weddings, as well as some sporadic institutional outbreaks, as well as cases as well linked to close contacts. And this next slide here, so this gives a bit of a high-level snapshot of the confirmed active or ongoing outbreaks right now. So as you can see, workplace outbreaks are currently what we have the bulk of, and then a couple of institutional outbreaks, childcare center outbreaks, and one school-related outbreak. And Dr. Gould will be speaking to the school-related situation a little later. So this shows again over time and the outbreaks and how that correlates somewhat with the line graph and the cases we saw in the last slide. So our institutional outbreaks early in the pandemic did have a large number of cases associated with them. Reassuringly, the recent outbreaks have not had too many cases associated. And similarly, workplace outbreaks used to previously have more cases associated than we're seeing now. The few outbreaks at childcare related settings that we've had do correlate where we did see a bit of a spike or peak in terms of our community transmission in May and in September. And what's not captured here is some of the suspect outbreaks or situations where we're monitoring or conducting surveillance as well across the various settings. So we'll go into a few immunization updates here, and we'll be starting off with influenza. We've been getting a number of questions, and it's that time of year, and knowing as well, you know, there's challenges and considerations with COVID-19 during flu and respiratory outbreak season. We often look to the Southern Hemisphere for indication of what we may anticipate could occur here in Ontario, and provincial partners such as Public Health Ontario and the Ministry look at this and track influenza here in Ontario as well and support with resources. So some of these slides here, some of the information is from our provincial colleagues, and we'll make sure that there's links as well to their resources, as well as a recent webinar they had as well, in case that's of interest. What we have seen in Australia and the Southern Hemisphere is definitely an increase uptake and interest in flu vaccine. And with the COVID public health measures in place, you know, a dramatic decline in the number of flu cases you'd usually expect this time of year compared to previous seasons. And we do hope and anticipate that that should be a similar trend in Ontario and here in York Region with the measures in place. When we look back at the 2019-2020 flu season, when the pandemic was starting and, you know, there were the measures put in place on distancing or the relative lockdown, that did end up having a truncated flu season for us last season. We do anticipate increased demand, and flu vaccination surveillance will remain important as well. And knowing that, our federal and provincial partners have also been ordering more flu vaccine doses. I believe there was a recent announcement in the last day or two from Premier Ford around the flu availability of over 5 million doses across the province for Ontarians, and they've announced a large flu campaign as well. We do know that, you know, knowing that flu and other respiratory pathogens and COVID do have some similarity in terms of symptoms, disease presentation, flu vaccination is especially important this season to help protect individuals and communities, reduce the burden on our healthcare system, and decrease illness that, you know, can be hard to tell between those different types of infections that can happen. And hopefully this will also decrease the chance of co-infection in individuals and outbreaks in various settings with you know, COVID and influenza or possibly other viruses. When we're looking at a local level and within here in York Region, we have just to note, we have been in discussions with the ministry, who are the ones in charge of procuring and then releasing to all health units the flu vaccines, and we were able to get a significant increase in the allocated flu vaccine dose for our communities here, which was great news. We do recognize this is a challenging situation that, you know, all of you, our providers, are in, that we're in, and we're all going to have to look about, you know, how might we need to be delivering a flu vaccine differently, as well as our other vaccines during COVID times. As always, York Region Public Health will work with our healthcare providers to help distribute vaccines, provide guidance on immunizations. If there's questions around clinics or different public health measures you might need to or be considering putting in place for vaccinating your populations, you can feel free to reach out to us and we'll assist how best we can. I'll speak about the distribution and process and timing in just a minute, but just wanted to highlight as well, historically the ministry has emphasized the importance of trying to vaccinate high-risk populations first, so those at higher risk for contracting or having complications of flu or spreading it. But this year they recognize the current situation we're in and the importance of vaccinating on demand to help increase uptake in administration. So meaning when you get it, vaccinate in your clinics or as you're seeing your patients. But there is a request from the ministry for large-scale flu vaccine clinics that you may be thinking of having to hold off until into November, just to make sure that there's enough vaccine for those that are planning. And if you are planning a larger clinic, please feel free to reach out to us as well. We are also on our end, just to note, we will be, and I'll speak a bit about it in a moment, we do have plans in place and are gearing up for what more we as York Region Public Health can do to help with immunizing people for flu in our communities, recognizing there are some pressures on providers and some may not be able to see as many people. So we will be planning to be doing flu shots ourselves as previous, but at a larger volume this year, and looking at alternative ways as well that we may be doing it. So what can you expect this year? So like other years, a quick reminder in the process, we get our vaccines from the government pharmacy. They should be available for early October. Reassuringly, there's been no mention of no delays from manufacturing. None are anticipated at this time. So at the start of October, we'll send out a communication around what the flu products are that are available in a vaccine order form to all providers. And so you can send that into us and we'll make sure our teams are processing them as quickly as possible. And we do anticipate that we should have a flu vaccine available on or after the first week of October, so the week of October 5th for community-based providers. Just to note, pharmacies do get their flu vaccines separately, so not from the York Region Public Health flu vaccine supplies, but from a separate ministry contracted distributor. So what that means again is this is a snapshot of the publicly available flu shots that will be available. We do distribute first, as in previous years, to hospitals and long-term carers and have doses reserved for them, but then ASAP afterwards, it's going out to retirement homes, other congregate settings, and community providers as well. So most of these may look familiar. Just wanted to highlight a few of the updates or changes for this year. So a high dose TIV. So this is which has previously only been available to healthcare providers, will be available for pharmacies this year to immunize clients in as well. So this is one of the two main options in addition to QIV for those 65 plus. As a reminder, high-dose TIV is preferred over regular TIV for those 65 plus. There's been no head-to-head comparisons of high-dose TIV and QIV, but we know that given that influenza A strains tend to typically affect older adults and circulate at higher levels in Ontario communities, and it's often H3 and 2. So we know that with high-dose TIV, those higher doses of these strains in there can help protect older populations who may not be able to mount as good of an immune response. So this is a good option, but that being said, either vaccine, QIV or high-dose TIV is appropriate for these populations, and the most important thing is getting them immunized. And that's as well, just everybody over the age of 6 months who is eligible should be getting immunized, so please continue to promote that and provide that to your patients and providers. Pharmacies will be able to immunize those age 5 and up. Pharmacies as well are going to be receiving the first in Canada cell-based vaccine. So usually we have egg-based, and Europe and other places have been using a cell-based vaccine as well. Pharmacies will be able to administer this for 9 years old and up. And just a reminder that FluMist, the nasal spray that was previously available, publicly funded in previous years, again this year is not publicly available. I believe it may be available for private sale through pharmacies, but is not part of the publicly funded UIIP program. So that information will be forthcoming in other communications. So just switching gears and briefly, a couple comments. We know there are some challenges in terms of immunizing this year. We have sent out to all vaccine holding points at the end of August our first communication around flu, and did send out a resource of planning checklist that healthcare providers can use for helping make plans for how you may administer flu shots in your clinics. And you're also free to get in touch with us if you have any questions or anything that we may be able to help you in terms of advice or guidance. There's also helpful resources from the Ministry of Health that were sent out in terms of immunizing during COVID, and guidance for flu vaccine delivery as well during the times of COVID. And that was a Government of Canada or NACI resource that also highlighted some adaptations to the usual practices. So for example, things like the importance of and going through about screening of, staff, volunteers, patients as well in your clinic, about physical distancing, what may need to look different in terms of your layout or the flow in your clinics or number of clients, about infection prevention control and PPE. Measures that may need to be in place, environmental cleaning, changes possibly to your staffing or hours or how you operate your clinics may be considered, as well as things like appointment systems or booking to help reduce people congregating or clinic crowding, and other technologies as well to help minimize contact. So again, there are resources that have been circulated. We will recirculate and also be posting these on our website, and feel free to give us a call if any questions. So there's been some questions as well around the grade 7 immunization program, which had to be put on pause, unfortunately, during the height of the pandemic, and as schools were closed and shut down, and all students have had an extended March break. So now that we're into the new school year and trying to help play catch up to make sure that these important immunizations can reach our students' arms. So we did send out a communication recently about this delivery model change, meaning that this year we're no longer able to be in schools for providing those immunizations of meningococcal, hepatitis B, and HPV, but we are going to be doing community clinics across the municipalities of York Region so that we can help enhance opportunities for students to get immunized. And knowing that not everybody's in classes and maybe doing online learning, is we're trying to figure out the best way to be flexible and have opportunities for students to come and get immunized. And school boards will be helping get out that message as well. We will also be ensuring that the current grade 8 students who missed their second dose of the grade 7 program last year, when they were would have been finishing off the grade 7 year, will be able to get this too, and they'll be able to book in online or call and book by phone if need be, if there's any questions or concerns. So the eligibility has been extended. Just to note as well, healthcare providers, if you would like, and if there is a patient of yours, that them and you are more preferring that they might get those vaccines in your clinics, that can be done as well, and you can get in touch with us. But just to note, we're not relying on healthcare providers for immunizing all those students. We will be doing clinics ourselves to help assist with catch-up and keeping students stay on track. There have been some resources as well that have gone out from the ministry, and as well, if you have questions about patients of yours that may need catch-ups or have had missed doses, feel free to reach out to us. Most are fairly straightforward. However, there are some where if there's an interrupted schedule, so for example, things with tetanus, diphtheria, pertussis, etc., that they can be a little bit more complex. So there are some resources that are available, and you can consult with those, the ministry's publicly funded immunization schedule, or give us a call or check our website as well. I won't go into detail here, but this is just an example of another resource we've developed. It's a simplified version of the ministry's publicly funded immunization schedule, where it shows one check mark for a shot that's administered that might have multiple antigens in there. And one thing just to highlight as well, as we are moving into influenza season, co-infection with flu and pneumonia can lead to worse outcomes and increased hospitalization. So it's just a plug to please remember to consider pneumococcal vaccine as well to help prevent pneumonia at high risk groups as well, and older folks as well. So, and immunization across the lifespan is important. So thanks for the work that you are doing for helping keep your patients protected. This slide lists a number of resources, and once again, we will circulate slides and have these available as well as a recording online, and make sure you've got links for a number of local, provincial, and national documents that may assist with flu, general information on immunizations or vaccine storage. And as always, our websites and our teams are here as well if there's particular questions. And at this time, what I'd like to do is hand over to my colleague, my fellow Associate Medical Officer of Health, Dr. Richard Gould, to talk about school reopenings. And just a reminder, if you do have any questions, please feel free to submit them on the chat function, and we'll be monitoring them on our end. And at the end of the presentation, we'll loop back to some of your questions so we can answer them.
Thank you, Alana. It's Richard Gould here, and I will cover some of the an overview of what's happening with the school reopening. So if we could get to the next slide, please. Just to start out here, you may have been following what's been happening in York Region with cases in schools. So here's just a quick little synopsis. We do have cases in 9 and 10 schools. One of them is actually in an outbreak situation. By outbreak, what we mean is there's 2 or more cases that are linked within the school. That particular school, there's just the 2 cases. All the other ones are a matter of 1 case being diagnosed and notified in that particular school. So if we can get to the next slide. This is just an overview of the age distribution among the children. And as you can see, one of the groups that tends to have a higher rate of infection is that 15 to 19-year-old, which is probably not much of a surprise. We have, as you can see, been seeing cases throughout the summer and through the spring. It's a bit early now to see what the impact of school opening is going to be as we go forward, but we'll be checking on that carefully. To kind of give some context about this, the number of cases that are under the 19 age group, it's only 5.6% of all the cases in York Region. We have 224 cases in that age group. So it's not the most common, or it's not the age group with the highest number of cases in the region. So just to give you a bit of a context when you're looking at these numbers. Next slide. So this gives you an overview of actually what the roles and responsibilities are, how they're divided up between York Region Public Health, and concentrate primarily on York Region Public Health in collaboration with the school boards. And so we're doing case and contact management, outbreak assessment, surveillance, coordination, and communication, using Ministry of Health guidelines. And we work very closely with the school boards and the principals to ensure that any suspect cases are notified to us, and that we follow up and we get information that we need in order to enhance that case and contact follow-up, and working very closely with the school boards and principals. And we'll get a little bit more into the detail of what actually what that collaboration is. So next slide. And again, here just a quick overview of the process, and just indicates that when we do get notified of a case, that we work closely with the school to identify the close contacts and then determine what should be done in terms of the contact management and the case management. And we have close communication with the school so they know what is going on. And of course, we're checking to see whether or not we have additional linked cases, in which case we have an outbreak, and that would necessitate some additional measures to be taken. Next slide. Next slide. Oh, sorry. So one of the questions that has come up is, why are kids in school, sort of thing? Is it too risky or whatever? And as you can see here, there's a number of benefits, and you can check more of them in more detail if you want to take a look at them. Good synopsis is in the guidance for school reopening from Hospital for Sick Kids, that you get more information about that in particular. So take a look at that. Basically, there's a lot of problems. There's a number of concerns for kids because of their isolation from their friends, their peers, etc., and the mental health, social, emotional issues there, and it's important for them to be in school. And if there's any group that we should be allowing to regain some more normality in their interactions, it's the kids, and maybe we lock down or decrease some of the activities of the other sectors so that we can protect the kids in school. So next slide. So here again, just I think we might have missed a slide in terms of the, there it is, the symptoms. This was actually, to complement what we were just saying in terms of the number of cases we've been having. As you may well know, generally in children, the severity is quite less than it is in older adults, and this is just a summary of what we are seeing, what Public Health Ontario has collected in terms of the symptoms in children, those under 19, a large proportion that are asymptomatic, and of course the ones that are more common are the fever, cough, etc. The Canadian Pediatric Surveillance Program has additional information just indicating that the impact on children is more limited. This is a surveillance network of 3,000 pediatricians across the country, and just indicating that the number of hospitalizations and ICU admissions and deaths are low with this group. And of interest in the surveillance program, they've noted that of all of those kids who are hospitalized, about 50% of them are, it's not because of COVID, it's just that they happen to be there for something else, surgery or whatever, and have been assessed, and they test positive for COVID, but they're not actually there because of COVID symptoms. So the impact on children is relatively mild. And the other thing is the experience in from across the world, basically, is that the transmission from children in school and transmission from children to adults in their families is limited. So that's part of the risk equation that we are factoring in, and that just goes with the other benefits of being in school. So if we can skip ahead again. Yes, so this is just telling what happens in schools. So one of the key processes that's in place is the need for students and staff to self-screen before they go to school. We basically, and that is, because the main thing is we want people that are children and staff who have symptoms that are suggestive of COVID to not be there, unless there's some other explanation. We'll get to that a little bit. That explains those symptoms, and otherwise they should be tested. So, next slide. And this is just a screenshot of what our screening tool looks like. This is we have a paper version, and we have a version that's that can be also obtained at our website. So these are the symptoms that the parent will be going through. There's also a ministry online screening tool that parents can use, and it's still being adjusted somewhat, but it may be another way of, and perhaps a more user-friendly way of doing the screening process, and it comes up with guidance about what you should do depending on what symptoms or situations you clicked on for your child. So that is also available to help out parents. And next slide. So one of the things that you might find is because some children have pre-existing symptoms or syndromes or conditions, the parents might be reaching out to get some guidance in terms of what to do there. So it's helping them out to provide them with information about what they can then communicate to the school, because and when you go through the screening criteria, etc., it does deal with a number of situations where a child who has a pre-existing condition, like maybe seasonal allergies or things that would cause the presence of symptoms that are similar to COVID symptoms, if they're not new, they haven't changed, etc., then it's the sort of thing that they could continue to go to school. So next slide. And again, around this, we're not requiring, and the school's not requiring actual notes from from healthcare providers. As I was saying, what you can do, what we're asking parents to do is to inform the school about, is there a pre-existing condition that my child has that would explain these symptoms, and that I have consulted my healthcare provider in the past. So, and they will provide an affirmation of this to the school. So if you have any guidance, if they reach out to you to ask about what they should be saying, that might be helpful, but we don't actually require medical notes or negative tests initially for that. So it's mostly the parent's responsibility to inform the school if there's an explanation for what the symptoms may be. So next slide. And this is just quickly, just what the school nurses says. You probably know that we have a number of nurses who've been hired. They're working with the schools and to support the principals and the staff at those schools, a whole range of things around the control and prevention of COVID in the schools. There's more schools than there are nurses, so they're assigned to a geographic family of schools, but they will from time to time, depending on what the needs are of the principal and what's happening at that school, will be present there to help out. The next slide. So the main thing is, you probably guess, any symptomatic individuals with symptoms that cannot be explained from a pre-existing condition should be excluded from the school environment. And if they test positive or they meet the probable case definition, their household contacts would also self-isolate with them. So that not only would the child not be in school, but their household contacts would be also required to be self-isolating. And certainly, if you become aware of a case, the suspicious, probable case, or whatever, then we would very much appreciate you letting us know so that we can then work on that and inform the school. And I think that here's just a number of resources that we have that you can get a bit more information. And I believe that's the end, and we can then entertain some questions.
Great, thanks, Richard. So just pulling up the chat box, and there's been a number of questions that have been submitted. So thank you all for that, and please feel free. Once again, there's that live event Q&A box where you can click and submit questions there. And just as a quick reminder, we'll answer what we are able to hear, and we'll also make sure that we loop back that anything that is not answered, we will have written responses going out, and we will be disseminating those along with the slides. And the written answers via the Public Health Matters listserv, which we'll have information on for signing up as well later. And we'll also be posting the webinar recording and the slides online. So one of the questions I can answer was to do with one of the earlier slides when I had mentioned or was briefly discussing about the epidemiology, and this was around the close context, local transmission, under investigation, and unknown. So that blue line where we've seen ongoing, that's been a significant enough portion. And particularly the question was around, out of those, how much are really unknown? So if we break it down across the pandemic, the unknowns are actually about 1% of our overall cases. So the vast majority were able to identify where it's anticipated that somebody or believe that somebody has acquired it. So for example, a large proportion, approximately 40% across the pandemic, have been close contacts. So often these are household or very close non-household contacts. So that is a large bulk of it. Local transmission, meaning in the community, has been over 20%, I believe about 22%. And then the under investigation piece is just where, they might be the new ones that have just come in and we're trying to determine any linkages, and then unknown, where we really just haven't been able working with the clients or the individuals to help figure it out and sort of sleuthing it. Any possible answers are under 1%. So moving over to a question, I can answer this quick one, and then I'll about flu shots, and then I will hand over a school one to Dr. Gould. So there was a question about, are we going to be setting up flu shot clinics at schools? So we are not going to be in schools this year. We have been in communications with our boards, and we will be doing community-based clinics instead, where we will be doing, you know, some of the grade 7 immunizations and others, and flu shots there as well. So we'll be making flu shots available through our community-based clinics, and we will not be administering any immunizations in school as of this time right now, in terms of where it currently stands. So I will, a question for Richard. So one of the ones that has come in is, in the event of a positive test in a school, are all children in the cohort or class going to go home for 14 days? Sort of why or why not?
Okay. Well, that would be part of what we do in terms of the investigation, to look at the nature of the contact between the case and the others to which they were exposed. It depends on what personal protective equipment was being worn by the case. Say, for instance, a teacher, and also their relationship with the students. If they were wearing their surgical mask and they were distanced more than 2 meters from the students, then there's a fair possibility we wouldn't consider the children exposed, although, again, we have a high index of suspicion. So if there's any concern at all that there might be a breakdown in terms of how close say the students get to the case, then we would be looking at dismissing the cohort. And as I say, we use basically a low threshold to a large extent in ensuring that the contacts are managed most appropriately, so as not to have any further risk in the school. But it's not a hard and fast for every situation. We basically sort out the situation with every one of these situations.
Great, thanks, Richard. And there's another question here. I can answer this. It's a sort of general one related to school, but also in general, about why is one negative test potentially enough to bring students back to school? Or, I mean, it could apply elsewhere if someone gets a negative test, and if there's concern over sort of false negatives, but really, why is it the one negative? So just to mention, I think also it is, just building off what Richard said, it's in the context as well, of, you know, if someone is known to have had, you know, a high risk exposure or be a close contact of a case, they're advised to go get testing and would be off in isolation for 14 days. So even if they had tested negative, they would not be going back if they were a close contact. If there's any concerns around sort of lab, you know, the quality of the specimen or the run, which doesn't happen that frequently in terms of the specimen quality or run, then that may be shared sometimes with us or the ordering physician. And then other situations, you know, if it is, say, someone has a symptom and you know, no known exposure to a case or a probable case or anything, and receives a negative test, usually once their symptoms have resolved at least 24 hours and they're not a close contact or at high risk, they are able to go back. What I would say is, if you, you know, if there is actual concern, you know, over potential exposure or concern over the test, or this individual, say they continue to be symptomatic or develop new symptoms, it is advisable they stay home and also consider retesting. So I will, a question maybe for Richard here, is if you might be able to comment on the sort of policy or differences or in advice or recommendations around masking for children. So, for example, you know, why for younger kids it's not being required in schools, and in other jurisdictions, you know, they may have different policies. So if you're able to comment a little bit on the masking in kids here in York Region.
Right, and there is some variation across the province, as you may be aware of. Some areas are following the current guidelines from the Ministry of Education, so that the younger kids JK to grade 3 are not wearing masks, or not required to be wearing masks in school, versus the older children. The reasons for that is weighing the benefit of the mask versus the risks to that child. And for many children, the younger ones, it's difficult for them to safely use a mask throughout the day. They're wearing it for a very prolonged period. They're not used to it, and they may be fiddling and adjusting and not using the mask appropriately, so that they're more likely to contaminate their face and be exposed in that manner, because just they're not using the mask properly. So and we also know that the benefits, or the risk to the children, is rather limited, in that the younger they are, they tend to have milder illnesses and symptoms and less likely to get seriously ill. So it's weighing those risks and benefits. And what we do suggest is that the parent who knows the child best work with the child. And if they feel confident that the child can wear a mask safely and appropriately in school, then by all means send them with a mask. That's not a concern at all. It's just that aspect of whether it should be mandatory versus based on the parent's best judgment with their child.
Great, thanks, Richard. So I notice we've got a number more coming in here. Try to get through some quick ones. There's been a few comments around the idea of a contact of a contact. So, you know, if a child or someone is told to isolate or come home from school or the community because they're a contact, but they're entirely well, what does that mean for other household contacts? Do all household contacts need to stay home as well if everybody is well? So just a quick note, for close contacts, they are to self-isolate for the 14 days. But if that close contact is well and asymptomatic, and then in terms of their household members, the household members, if they are well themselves and their household members have not been exposed, are feeling completely fine and no concerns otherwise, they are not required to also isolate because of being a contact of a contact. Of course, if there's any exposures or anything changes in terms of health status or something, that might be potentially revisited, but a contact of a contact who is well does not necessarily need to isolate at home. I will question just in terms of appropriate PPE in school settings. Does that include eye protection? And maybe, Richard, if you're able just to comment on that and PPE for schools. I'm presuming this is around staff, educational workers.
Right, and we suggest or recommend is if the staff person is going to be closer than 2 meters of the children or the students, that eye protection is advised in that kind of situation. And they may be particularly cautious because one of the situations is they can't always predict whether or not a child is going to maintain that 2 meter distance. So in that case, that situation, we're advising that a face shield would be appropriate in combination with their surgical mask. But if for whatever reason they are absolutely certain they can maintain the 2 meter distance safely, then they can just wear a surgical mask.
Great, thanks, Richard. And I'm mindful of time. I do notice there's a number of other questions. Again, we will respond. So just moving on to one or two of the last slides, just to highlight some resources. Also to note, I do see a number of questions around pharmacies and COVID testing or changes that were just announced I think shortly before the webinar by the provincial government. So more details are coming. We haven't ourselves heard all details yet, definitely around pharmacies. I think we're all waiting to hear what that means and what that will look like. So we will make sure information is communicated. So there are some additional resources just to highlight here. So the Public Health Matters newsletter I mentioned on our York.ca Health Professionals page, you can sign up there, and that's a way to get important updates as well as the slides, as well as the FAQs, answers to your questions after this, and the resources or links, and we will also post it on our website. a few other links that you can bookmark. Again, some of our York Region web pages for health prevention professionals and around COVID. We will also make sure you have or can link through there to the Safe at Schools section of our COVID site, as well as information about influenza and other immunizations. As well as some provincial partners with Public Health Ontario's. They have a number of resources around COVID and influenza and others, and same with the ministry. So we'll also make sure those are up. And lastly, a reminder as well, our healthcare provider phone and web resources are always available. So if you do have questions or concerns, the extension and the hours and as well as our websites are available there, and a reminder to sign up for our Public Health Matters. Thanks as well for everyone for joining in today. Stay tuned as well for the information and slides, FAQs and follow-up, as well as information on our next healthcare provider webinar that will be coming in October, and you'll be getting a communication in the coming weeks about that as well. So we are aiming to do these approximately every 4 weeks or so. Thanks again, everyone, and stay well, and thank you for all the work that you're doing for you and for your patients and all of us here in York Region. It's really appreciated. Take care.